Welcome to Apps for New South Wales, and what we're talking about today is a new unique opportunity in Australia, first for New South Wales, whereby we're developing health apps in conjunction with yourselves. You, the experts, the clinicians, the consumers, the health IT industry, researchers and academics coming together to develop a range of health applications that are useful for clinicians, for consumers, for the system as a whole, and for providing information back to all of us.
From our perspective, Health is really interested in participating in the Apps for New South Wales competition because over the past 4 years we've really, built up a lot of maturity around our clinical systems. So I think we're now at a point where we'd really like to start exposing that information to not just the clinicians but also our consumers to really start to make use of it in a better way, in a more agile way.
So what we're interested in and what we think the challenge is that whilst we have all this interesting statistical information out there, is how do we bring it to life? How do we mobilize that information? How do we make it more interactive, more engaging and more relevant to the public?
New South Wales Health provides health information on a range of issues in a range of formats, be that from people with pre-diabetes to smokers, overweight and obesity, nutrition, physical activity, new mothers, mothers-to-be. We provide information on websites, brochures. Consumers will also receive it personally from their clinician. Is there a better way for us to provide this information that particularly technology savvy and perhaps younger people would appreciate the format of? I'd be really interested to see if there's better ways for us to communicate with the community about their health and what to do with it.
We're focusing on 4 central themes.
The 4 themes that are going to be shaping our strategy as we move forward will be firstly around supporting clinicians better in the information we provide them, enabling system reform, so changing models of care and the way we deal with patients, enabling the transfer of care to primary care, and most importantly engaging with consumers as well. The first theme we're really looking at is better supporting our clinicians, and by that I mean we're looking at taking the data sets that already exist, whether they be clinical data sets around images or alerts or diagnoses, and just no matter where they were taken, in a hospital, in a community health centre, wherever, making those available to the clinician where they need them. From a system change perspective, we've got some great data sets now around bed utilisation, transfers, handover of care that hospital managers are starting to use to better manage patient flow through the system. So what we're really interested in doing is trying to make that information truly mobile and trying to get some more analytics out of it. So one of our first enterprise attempts at building some mobility around a solution is our electronic blue book. Why it's unique is because it gives all care settings the chance to contribute to the care of the patient, in this case the baby that's having the immunisations or health checks and so forth. So it allows hospitals to register that baby. It allows community health to enter health checks around that as that's occurring. It allows GPs to do all the head circumferences and all the things that the GPs do. But most importantly, it lets the consumer enter notes, reminders, etc. The last component of our strategy is really around enabling the consumer, and I think this is extremely important and a big part of what the Apps for New South Wales Challenge needs to look at. So what we really need to be thinking about is how we empower consumers. The example I've heard to date is the way that Virgin is allowing their customers to order in-flight meals from the Wi-Fi network on their aeroplanes, and I don't see any reason why we can't be doing that from our hospitals as well.
Interested and excited about this opportunity to see how innovation in presentation of the data or combining different data sets, both from government sources as well as private sources, could help us develop a rich and interactive picture of health in New South Wales.
We'd be really keen to see if there are some savvy people out there who can coordinate all those sorts of health providers into one app. Where do I go for this information? How do I do it? Is there a useful way to tell me where my local park is as well as my local hospital? What hours are these things open? How much do they cost to access if they're not publicly provided? All these sorts of things would be useful to have at their hands.
So this is a competition. It's calling for you to come together in a relatively short period of time, but that focus is really important. The competition is now open, and you can find details of the competition on the web address shown below. The competition closes on the 30th of November of this year, and unlike many other bureaucracies, we'll make a decision and we'll make it pretty quickly. And by the 14th of December, we'll have an answer as to who the winners of this competition are. So there's a small amount of money, $5,000 for each of the key theme areas, $20,000 in total for the winners of this competition. So let's get together and let's see what we can actually develop to actually make a healthcare system a better place for our patients and our clinicians.